My name is Christopher Travers. I'm one of the joint surgeons at Penn Medicine. I've always been interested in medicine. I do have a number of physicians in my family, so I was exposed to it from an early age. But orthopedics really drew me in because I was kind of amazed at the quality of life improvements that we could provide for our patients. So we really literally give the gift of mobility and the ability to walk. The type of patients I see, they vary in age, but the vast majority suffer from osteoarthritis. I also take care of patients with deformities or rheumatoid arthritis, basically anyone who has a damaged joint, either a hip or a knee replacement. And my focus is on non-operative treatment initially for most patients with medications, injections, therapies, bracing, but I also offer orthopedic surgery in the form of joint replacement. My patients can expect that I'll be there when they need me. It's really a relationship. Typically, I'm not trying to push surgery or trying to force them down a certain path. My goal is really just to provide information and provide options and help the patient work through that and make a decision. This is an elective procedure that's meant to make people feel better and walk better and really, like I said, improve quality of life. One interesting patient that comes to mind is an older woman in her 70s that had suffered bilateral hip fractures. So she had been treated in the past with screw fixation, and unfortunately, the bone hadn't healed properly. So both of her hips had really degenerated to the point that the screws were exposed and were touching her bone and causing significant pain. And when I saw her, she was wheelchair bound. And about a year ago, she underwent a successful total hip replacement. And actually yesterday, she underwent her second hip replacement, and she's been walking around the floor with a walker, something that she hasn't done in a very long time, as soon as the day after surgery. So it's something that can really provide a vast change in someone's lifestyle and their quality of life. I think one of the biggest advancements in orthopedics now is probably robotics and computer navigation. This is a way of measuring really precisely. So measuring down to the millimeter, to the degree, and then customizing that implant to the patient's body. It's still me doing the surgery. I'm still using my own hands and making my own decisions and judgments, but this is like a very precise tool that I'm using during that. The best part of the job is the day after surgery, making your rounds, seeing the patients on the floor, and then walking into a room and the patient's not there because they're walking around the hallway. And you kind of catch them in walking, they feel good, and then seeing them follow up and just seeing their life improve and their pain decrease. It's really gratifying seeing that you can improve someone's life that much.